Thank you for joining us today for our survivorship special topic in March. My name is Julie Lanford, and I am the Wellness Director at Cancer Services. We are a cancer support nonprofit in Winston-Salem, North Carolina, and each month, Cancer Services posts a special topic video with experts in a variety of areas related to cancer survivorship and caregiving. And so these videos are posted on our website and our YouTube channel. And the audio is also available on our podcast, so you can check out the past topics if you're interested. All survivors and caregivers are invited to join us for a discussion group on the fourth Tuesday of each month. So in March, that will be Tuesday, March 28th. We are only offering a Zoom session this month, so that will be at 6 p.m. And you can register for that at cancerservicesonline.org/register. To get the link to join, and we'll send you a copy of the video and the discussion guide if you haven't seen it yet. So our special topic today is on cancer brain, tips and tricks for coping. And our expert speakers are Claudia Koliscak and Sara Bridges, both of whom are with Novant Health here in Winston-Salem. And we decided to do this topic because it's a very common issue that people are going through cancer treatment phase, and 75% of cancer survivors do report cognitive dysfunction, and about 35% experience those that go on for months or years afterwards. So it's a common issue that many people are facing, and we do have some tips and tricks for you, so you don't have to feel hopeless about that. But first of all, I do want to introduce Claudia Koliscak, who is a speech therapist with Novant. Let me stop my screen here. And Claudia has 14 years of experience as a speech therapist. She's worked in multiple settings, from acute care to inpatient rehab to outpatient care, as well as home health. She does have a history of working with cancer patients and now specializes in neuro and cognitive disorders. So welcome, Claudia. Thank you so much for joining us today.
Hello, can you hear me?
Yes, sounds great. So help us kind of with a little bit of background around this topic, because I guess I've been working in oncology for, 15 years or so, and it has been kind of a topic of discussion over time, but I do feel like it's still kind of relatively new. So can you give us some background on cancer brain or chemo brain?
Yeah, sure. Cancer brain is a phenomenon that happens to folks who are receiving cancer services. Sometimes it comes about during their treatment, sometimes it comes after their treatment, and it can linger for a while. And it just leads people to feeling as though they are experiencing clumsiness or spaciness. Oftentimes people will say, I just don't feel like myself, or I feel really forgetful or even ditzy. And the wild thing is that we don't know exactly what causes cancer brain. We do know that it's likely multifactorial. And so sometimes it's caused by the location of the cancer itself. For example, if the cancer is located in the brain, then that could contribute to some decline. But sometimes it's the medications that we use to treat the cancer. Sometimes it's the chemicals that our body produces to fight the cancer. And then there's a whole slew of other things that can contribute. And that would include severe anemia, pain, medications, inflammation in the body, even things like anxiety and depression and fatigue and deficiencies. All these things can really play a role.
Yeah, so it can be pretty complicated, the cause, and sometimes, with a lot of things, we don't always know why, and it's good to have that conversation with your doctor or your medical team about, this is what's happening. Can we think through what might be causing it? Do I need any extra testing? But other than sort of the side of trying to diagnose why, I want to talk more about what can we do about it. So what are some things that have been helpful for people?
Yeah, sure. I think that we have to put things into perspective and recognize that life is really complicated when someone is actively going through their cancer treatment. They are dealing with appointments and transportation to and from these appointments, You're handling medication changes, insurance coverage, all these different providers that you're now suddenly seeing. And so it's like, no wonder there's a lot going on, because you're dealing with so much more than what life normally throws you, which is already can be a wild ride. And so thankfully there's things we can do. And one of those, my biggest tips, is trying to stay organized. And I realize that that's not everybody's forte, but it's probably simpler than what you think. I think the number one thing that someone can do is keep a binder and keep everything in this binder, right? So you're going to have a folder for all of your papers. You're going to have a notebook to take notes in after you have some of your appointments with some of your providers. You're going to have a place in the notebook where you can write down questions, right? Or little things that you think of. And I would keep this notebook in a really prominent location of the home. So I would not stash it in the car. I would not, keep it in your closet. I would keep it out like on the kitchen island where you see it. And when you're doing the dishes, you think, oh yeah, I meant to ask my oncologist that question. Or, your spouse mentioned something and you say, yes, I need to take note of that. So it's right there and it's super accessible.
So would you this is a notebook that would have medical information and personal information, or would you keep those kind of separate?
No, yeah, I think it all can be combined, right? Your medical information and your personal information go hand in hand. So I've had patients before who like to write down, kind of what happens after each one of their appointments, so that they can kind of go back. It's almost like a memory log, if you will, almost like a diary entry type of thing. That's proven to be really helpful for some folks. Some people like to make little voice recordings so they can kind of go back and listen to some of the things, some of the takeaways from their visits.
Gotcha. That's really handy. So some people might be wondering, well, why do we have a speech therapist on for our expertise, which, like we talked beforehand, is that sometimes people aren't quite aware of what all a speech therapist is trained and specialized for. And so I think it'd be really awesome for you to share how your training or your expertise, especially in the neuro and cognitive areas, fits in with these tips, and then what people might benefit from if they were to see a speech therapist.
Yeah, I love this question, because it is, I have dealt with this question millions of times throughout my career, where people say, why am I coming to see a speech therapist? My speech is totally fine. And what we have to often educate folks on is that our title is a speech language pathologist. And so we deal with communication holistically. And if communication goes awry, oftentimes cognitive functioning is the main source of that. And so we treat cognitive communication disorders. That is part of our specialty and our scope of practice. And so that has everything to do with our higher level thinking skills, our executive functioning, and if that's a new term to you, that refers to attention and processing and thought organization and memory recall, right? It's a lot. But we are CEOs of our own brain. And sometimes when there's cognitive deficits that take place, the cookie can crumble, if you will. And that's where speech therapy comes in. So we are trained to offer folks compensations and strategies and cues to not only help improve and rehabilitate some of that cognitive function, but also just to kind of compensate for it, right? Because even if we're in a place where we're not necessarily making progress, we can meet you where you are and say, okay, how can we make this simpler? Let's break this down. Have you thought about doing it this way? Or did you know about this resource? And so those little things are incredibly valuable to people. And all that it takes to come and see a speech therapist in the outpatient setting is you would have a conversation with your provider, doctor, oncologist, your PCP, whoever. And you would say, I feel like I am dealing with some cognitive changes because of the treatment that I'm going through or have went through. And I'd like to see a speech therapist to work on my cognition. Check, done. Next thing you know, you're in my inbox and I'm calling you in to get you scheduled for a visit. So
awesome. And pretty much every medical facility has speech therapists. They probably are, not located per se, like in the cancer center, but they are a referral source that people should not have too much trouble getting access to if it's something they need.
yeah, absolutely. I mean, we're located in Winston-Salem, have a very easy location to get to us. Parking is very simple. It is not complicated. You are not going to have to be coming into the hospital every day. This is a very wham bam, you're in and out, 45-minute session.
Awesome. That's really helpful information. And I think maybe a resource that some people haven't considered. So hopefully they will consider or have a conversation with their doctor if this is a challenge that they're dealing with. So thank you, Claudia, for sharing your expertise.
Thank you.
And next, we're going to bring on Sara Bridges, who is a licensed clinical social worker, and she is at Novant Cancer Institute here in Winston-Salem. She has been practicing as a counselor for 20 years, and her focus has always been around coping with medical health challenges. And currently, she is the counselor at the Outpatient Cancer Center at Novant. So welcome, Sara. Thanks so much for being here. And I think it's a really great tie-in with Claudia's information, because she mentioned some things in the multifactorial causes of cancer brain that very much play into counseling and mental health. So can you share some about how you've seen that cancer brain affects your patients?
Yeah, absolutely. And if it's okay, I'm going to share my screen because I did put a few things together that I thought might be helpful. Let's see. You can't see my screen though, can you?
Not yet. I feel like it's coming.
It's coming. It is definitely coming very soon. All right. How about that?
Yep.
Okay. All right. So some typical concerns that kind of come up with patients when they're experiencing this is, and Claudia kind of touched on this, is kind of getting a grasp on something that's hard to grasp, right? I mean, she described it in several ways that are really helpful, and patients kind of describe it in a lot of different ways, because it's not like I can say, oh, this is exactly how it feels. It's just this kind of new thing that starts to kind of creep in and things start to change. So that's hard. And then I would say work challenges is another concern. And that could be, if you're a mom home with kids, your work is managing all of that. Or it can be if you are working outside the home, or even just like she talked about, keeping up with all the appointments and medications and calling insurance and all of those things. Work is a lot of different ways. And so whatever task things we each do, those tasks can get harder. And that can be really tricky for patients. So that's another concern, is just, how do I continue to get things done that I need to get done, but they're not happening the way they did before? And then, like, how long am I going to have to deal with this? The unknown and uncertainty of that's hard, because again, it's not completely clear, and how much will clear up when medication clears up, or how long after treatment. All of those things can be concerning. And then just the fact that, life tends to go quite quickly. And yet when people are really struggling with this cancer brain stuff, it makes it feel like you kind of can't keep up the way you always have kept up. And that doesn't feel very good. So those are some of the big concerns that come up that are hard for patients, I think. So as you can imagine, some of the feelings that people have when these are concerns might be really frustrated, or angry, self-conscious, right? If you're a high-functioning person, you've always kept up with all these things, but all of a sudden you need to go a lot slower to get those things done, or the same amount of stuff is much more stressful to you now. You could be a little self-conscious and then worried about that, how things are going to unfold with this moving forward. I often, unfortunately, see that people are pretty disappointed, sometimes disappointed in themselves, I think, even though we'll talk about that further, but that's not really the most helpful thing. And then, of course, just the uncertainty. I mean, that comes with cancer in general, but also with this, because it's just so hard to understand. So now, what's the next question that everybody asks is, how do you deal with these feelings, right? Because none of these are feelings that we want to experience. So this is one of my favorite handouts, and it's because it's helpful with any difficult feeling, right? And these are things that come up from the cancer brain stuff, but it is just accept what emotion you're feeling, right? If you're really frustrated about it or really sad about it, and then identify and label it. And that really helps us to recognize what it is and then move to a place of kind of working through it. So you're accepting it, you're turning towards it, you're accepting it, you're labeling it, and then realizing that this is a feeling, right? So a feeling comes and goes. It doesn't stay with us forever. It's impermanent. So I'm really frustrated at how long it's taking me to make my grocery list, but I'm not going to feel really frustrated forever. This is happening right now. And then one other thing you can do is really kind of inquire and investigate. So, what's the trigger? What am I, what's making this harder for me? What's making me feel this way? That type of thing. And some of these steps also help us move from the sitting in the emotion piece of it to kind of moving forward with what, how to handle it, what to do with it, which really helps us move through the emotion. It helps it be impermanent. It helps us let go of having to control it or, deal with it in a certain way.
So do you have, like, if you're working one-on-one with somebody and kind of helping them to do this process, when they're off, not with you, like coaching right in front of them, do you recommend they go through these steps in a journal, or how would somebody implement?
Yeah, I mean, you can do it a lot of different ways. Obviously, I often print out something like this, and encourage people to, it's like anything else. You can get in the habit of kind of walking yourself through it, right? So, and I tell people, keep it like Claudia said, keep it somewhere where you can see it. And when you're really struggling and really feeling some tough stuff, pull it out and walk yourself through it. Now, the trick is it doesn't prevent you from feeling hard stuff. This is all hard. So the goal, we would love the goal if we had magic, fairy dust would be that we don't feel difficult stuff, right? But that we don't have that fairy dust. So the goal then is, how do we deal with the tough stuff, the stuff that is hard to feel? And that's where these kind of steps can come through. Now, it's like anything else. Once you kind of get to a place where you're starting to do some of this, you don't need the list to walk through it, right? You start to do some of it more naturally and just learn to accept how you feel, recognize it, and then it'll help you move through it.
Gotcha.
Yeah. So in addition to the feelings piece, some of the other things we can do about it is let people know what's going on, right? So I'm not saying you have to tell everybody under the sun, or you have to post it on Facebook, but to the people closest to you, let them know that you're experiencing this to the extent that you feel comfortable. And then let them know you're having a hard time with it, so that, so that they can be sensitive to it, but also so that, if I run into you in the grocery store, Julie, and I've been in treatment, and you ask me how I'm doing, and you say, how are you? And I say, oh, I'm great. Things are going really well. But if that's not really how I am, if I'm really been struggling with something and you and I are, great friends and I feel comfortable with you, then it doesn't feel good to kind of not match that. And so I think really encouraging people to be honest in a way that feels authentic and right. So for me to say, I'm doing well. I've had some, cancer brain, chemo brain type stuff going on, but I'm really hoping it gets better. And that's been tough. That feels better to me because it's more authentic. And it also just lets people know what's going on. So you're not feeling as isolated.
Well, I guess that goes in too with like, be authentic with your medical team. If you're noticing these things, it's not something to just keep to yourself, to ask for help.
Absolutely. Because like Claudia said, there's a lot of help out there that we don't really realize, but we do have to let people know. And you're 100% right, including your medical team, if that makes a big difference. Keeping track of the triggers to see, when do you get most frustrated? Are there days, are there times that are harder for you from a cognitive standpoint? Times of day, Claudia would probably know better than I would, but there may be, times of day that you do better or that things are harder. And so if I have things that require higher cognitive functioning, maybe I do those in the morning because I know that I function better in the morning. Whereas maybe before cancer, I could do those things any time of the day. So just kind of being aware of those things and keeping simple routines. Part of like her suggestion with the notebook, I think that can become a part of a routine that really helps, is writing down your appointment, maybe how it went, and a bullet point or two about what you take away from it. But the routines could be anything, with medication, maybe it means now my husband and I sit down together and we go through my meds, things that can make a difference and make things a little simpler. Also managing expectations, if you've just gone through treatment or you're in treatment or whatever the case is, or you're dealing with a diagnosis and you're also dealing with some, foggy brain stuff, then give yourself some grace to not, function the same, level that you have been, manage those expectations a little bit. And then I tend to encourage patients to, stay with the basics, right? Sleep is a huge thing. If you're not getting sleep, it is always going to impact kind of our clarity around thinking. Eating healthy and also moving, because that just moving our body, doing things like yoga or Tai Chi that connect our head and our body, those things can help. And then the two biggest things I really encourage is unitask. Now that's a weird word. I don't know that it's even in a dictionary, but we hear a lot about multitasking and we think that that's something we can do, but it's actually not real. I mean, our brain is meant to function, to focus on one thing at a time. And so I think a lot of people have this idea that, I'm good at multitasking, I can get lots done at a time, but what we're actually good at is jumping from one task to another and maybe back, right? So if I'm talking to you, but I'm making my grocery list, I can't think of those two things at once. I cannot think of what I need for the grocery store and talk to you. So what then I'm doing is talking to you and making my groceries and talking to you and thinking about my groceries. That takes a lot of energy and really high, cognitive functioning. And so I really encourage people in general, but especially if you're dealing with, the results of cancer brain, would be to really focus on one thing at a time. If I find myself talking to you but thinking about my groceries, I just need to refocus on you and talk to you. And then when we finish talking, I'll work my grocery list, right? Because
countercultural.
Yeah.
I feel like right now, like, you've got your phone and that's just the constant pull you away from the task at hand.
It is hard, right? I mean, and that's the other thing I will say about all these things is that, it's kind of easy for me to talk through them and give these suggestions. And I realize that when you're dealing with it, these are really, really hard things to do. And you're 100% right. It is countercultural, right? To focus on one thing and try and complete that and then move on to the next. I would say that I do think there's probably a good bit of research that tells us in some ways we're more productive when we do that because we aren't jumping back and forth. And so, I think that is one thing that I do often hear is that I've always been able to multitask and I can't anymore. Well, I mean, what that tells me is that, that jumping back and forth is just, it requires too much. And so it's kind of like if I have a, sprained ankle, I'm not going to go for a jog. if your brain isn't quite how it has been, then let's not try and multitask the way we always have. Let's really focus on, and it takes some intentionality, but I think that can be helpful. And I put mindfulness in parentheses because that's one of the ways that we can kind of do some of that is practicing different mindfulness things that can help us stay focused. And then being compassionate with yourself. I mentioned earlier that sometimes people are disappointed and they'll really say, like, I'm disappointed in myself. I should be able to do this, right? Because I could do it before. And as I have said before, should has a lot of shame with it, right? So the easiest way I encourage people to be compassionate is treat yourself the same way you would someone you care about. If you said to me, gosh, my brain just feels foggy, I can't quite do this the same way, I would never say, well, get yourself together. You should be able to do it, Julie. I wouldn't talk to somebody that way. So why would I want to send myself that message? But oftentimes I think people do feel a lot of responsibility and place expectations on themselves that is really hard. And so in addition to dealing with something hard like cancer and cancer brain, now they're feeling bad about themselves, right? So we've layered it on top of it. And so if we can take that part away, it still is hard, but at least we're maybe doing it in more of a compassionate way. So I think that's
yeah,
piece.
That's like it's kind of the second step to, or maybe, I don't know, the first step, but being authentic is like, this happened to me. My brain is not working the same way it used to. Like, it's a sprained ankle kind of thing.
Right.
This is what it is. And I'm going to, respond to that in a compassionate way rather than beating my brain up for not working right.
Right. Like, we want to help ourselves get through this. We don't want to make it harder. And if we're hard on ourselves about it, then that's not helping ourselves get through it. So it can be kind of tricky, but yeah, I think you're exactly right. I mean, I think it doesn't mean it makes it easy to realize it and accept it, but it is, I think, the first step in being able to work with it as best as possible.
Awesome.
Yeah.
Okay. So this is all super helpful information. Do you have, okay. I was checking to see. So I know that both Sara and Claudia, you're welcome to come back on, have shared, I think, some like really great tools and tips. And for some people, like they can take this information and feel like they can put it into place. And so I'm curious though, from both of you, if you had like one thing, so sometimes it feels like we offer a lot of things to people, like, oh, you could do this, you could do this, you could do this. So if you were to sort of narrow it down to one thing, what is it that you would tell people is kind of the most important thing you think they should start with? Sara, you can go first.
Okay. Well, I mean, I kind of ended on these, but I'll reiterate them anyway. And that, I think that's, I'm gonna do two instead of one. But first would be really to work on the unitasking, really work on trying to do one thing at a time, even simple stuff, because that, I think, can really be helpful, be something that is helpful now, but also is helpful for all of us to really be able to do. And then the other one would be to give yourself that self-compassion. You've been through a hard thing and you're trying to figure out ways to make it better. So let's be kind to yourself in the process of it. And I think that can be a helpful step in getting through this.
Awesome. And then Claudia, what's your one or two?
So hard. One is so hard. I had two as well.
Okay.
I think that the first thing is there is more support out there than what you think there is. And so I believe that oftentimes people come in and they just say, I'm dealing with this and it just is what it is. I'm just going to have to kind of see it through and wait it out. And that's not true, because there are providers like me who are willing to take a deep dive with you and explore what cognitive issues you're having and work on some of your cognitive endurance. There are support groups out there There are podcasts out there that also kind of, just to hear somebody else going through the same thing that you're going through is so touching for some. And then the other thing is to not underestimate the value of good sleep and sunshine and movement and positive influences, because those things are immensely important to ourselves as humans, but also to ourselves when we're going through things that are not ideal to our body, right?
Yes. Okay, so these are super great thoughts, and hopefully everybody has some take homes for this. And I do want to remind all of our viewers that we would love for you to kind of join. Speaking of, oh gosh, let me get the right thing. Speaking of hearing from other people or being able to share experiences and talk with each other, I would invite you to join us for our discussion group. So it'll be online on Zoom on Tuesday, March 28th at 7 p.m. And you can register for that at cancerservicesonline.org/register. And I will also put contact information for Sara and Claudia in the show notes and the YouTube notes, so that if you do have questions or you're interested in getting an appointment or a referral, you can reach out to them. So I think that's it for today. Thank you all, and thank you to our experts for sharing your information and being here. And for the viewers, you can stay updated on our survivor programs by checking the Cancer Services website. Make sure you're on our email list and following social media channels. And we hope that you have an awesome day and a great month. Thanks so much, everyone.
Thanks, Julie.
Thank you.